Hey everybody, we're going to be waiting just a few minutes as everybody gets logged in. We've got quite a few folks registered for today's webinar. We're very excited to have Patrick with us today and all the things that we're going to hopefully take away and bring to our own home theaters. So everybody can just hang tight for a few more minutes as we have some of the other attendees logging in for today's session. Couple of housekeeping things for today. If you go ahead and move your cursor towards the bottom of your screen, whether you're watching on your cell phone or you're watching on your laptop, you're going to notice there's several options down at the bottom of your screen, and one in particular is titled Q&A. So as we're going through today's presentation and there are questions that you'd like to expand on or a situation that you'd like to explore a little bit further, you can type that question into the Q&A. And we've got a couple of our CTAM board members that will be monitoring those Q&A questions, trying to prioritize those and get those to Patrick so that he can hopefully address those as we go through today's session. If you take a look at that Q&A and you find a question that's very similar or identical to the question that he is that someone else has asked, you can like that question, and that would indicate to us that there is more than one person interested in having that question answered. So it pushes it up towards the top of the priority list. So you can go ahead and you can see other people's questions and see if those are close to yours. And by doing so, we can get that question addressed even quicker. All right. So we're just about right at 6 o'clock right now, and I think it's a good time to actually get a little introduction going before Patrick starts with his piece here. All right. So Patrick, I'll be happy to introduce you here. We appreciate you all of you joining us for tonight's class on disaster recovery for community theaters. Our instructor tonight for our webinar is Patrick Hardy. He's a CEO of Hytropy Disaster Management, a leading disaster management company in the US for cultural institutions. A certified emergency manager, certified risk manager, and a FEMA Master of Exercise practitioner. He has extensive experience working in the public, private, and nonprofit sectors in disaster management, from micro businesses to Fortune 500 companies such as Google, Merck, and Parsons Corporation. During the BP oil spill in 2010, he was in charge of 23 emergency sites and thousands of employees in 3 states. In the summer of 2012, he became the first small business owner ever to be selected as the National Private Sector Representative to the Federal Emergency Management Agency, known as FEMA. Spending 3 months in Washington, D.C., constructing the first model small business disaster planning framework. Patrick has been featured on Good Morning America and other national programs and has been published in dozens of industrial publications. His experience is so extensive, he has been termed America's disaster planner. And we could not be more happy to have him join us here with our kickoff session of CTAM's Fall Conference 2020. A little bit different than we usually do things, but I have to admit we're extremely happy to have all of you with us tonight. Patrick, are you with us?
I am, sir. Thank you very much. I'm going to go ahead and share my screen and let me know if you're able to see it. Okay, give me just 1 second.
Looks like it's coming through perfect.
Great. Okay, well, thank you very much. Thank you, everyone, for having me this afternoon. I'm actually out in California. I'm about 100 miles from the August complex fire, which, for those of you who have been following the California wildfires, and unless you've been under a rock for the last few months, you realize that we're dealing with compounded disasters one after the other. And of course, California isn't the only place where we're dealing with that. But the recent fire here is notable for one particular reason. It is now called a gigafire, and for those of you who know what that is, it's it's a fire that has covered over 1 million square acres in a contiguous manner. And what I mean by that is we've had wildfires before in California that covered 1 million acres, but they weren't contiguous. So there was something in the way, there was a freeway in the way, or there was something that was blocking the spread of the fire in one direction. There was a mountain, there was a lake, there was an ocean. This is the very first fire we've had in over 10 years where it actually covered almost an entire forest. So it's pretty incredible. There are large counties that are now dealing with the August complex fire, as well as other ones as well. And one of the things that has become so important in the year of 2020 is to think about disaster management in a holistic way. And today we're going to talk about a few things a little bit differently than I would with other groups, because when you're talking about community theater, and for those of you who have heard other predecessor talks that I have given either with ACT or with other associated organizations, you'll know that I was a high school thespian. I was a collegiate thespian. My father, before my dad became a disaster planner, he actually was planning to spend his entire career in the theater as a drama teacher, and he found that he couldn't get a job, and so he decided that disaster planning would be a good backup for him. And so here he is. And so now I've sort of walked in his footsteps, and I am a disaster planner as well, obviously. And one of the things that I do when I work with community theaters and when I work with community groups and cultural organizations of various types, I work with museums, I work with sports organizations, I work with art galleries, I work with all kinds of organizations, is I try to look at the composition of the organization itself. How does it operate? And when I do that, I then learn about what it does. I learn how it operates. And then I say, how can I make a plan fit into what they're doing? And one of the things that I think people sometimes do is they try to find plans, and then they try to say, well, how can I try to jam it in there? And you say, no, let's try to have the plan evolve to fit the organization rather than the organization fit the plan. And COVID has changed all of that. And so today, I really want to talk to you about the 5 challenges that your theater is going to be dealing with in what is now termed the new normal. And when I say that, sometimes I get messages of melancholy where people say, I don't want it to have to change. I don't want the world to be different. Well, every time we go through a massive disaster, the world changes in some kind of a way. It responds to it uniquely. And there are 3 major disaster events that have occurred in the 21st century that have really changed the way we do things. The first is 9/11. And obviously 9/11 modified the way we did everything. For those of you who flew after 9/11, I actually had to fly quite a bit. I was a collegiate public speaker, and I had to compete. And so we were always on airplanes, and there were National Guards people at every airport where we flew into. After Hurricane Katrina, that was the second disaster that really changed things. The government discovered that we needed to have better preparation for natural disasters. And with the Hurricane Delta, which recently struck Louisiana, it reminds us once again that there is a ubiquitous threat of what Mother Nature can ultimately do. And then lastly is COVID. And COVID will have an impact in the way in which we do things. But I want people to take some hope. I want people to realize that there is a light at the end of the tunnel. This is going to be something where we're going to overcome it. It's something that is going to change us. And I think it's going to change us for the better. And that's one of the reasons why when I talk about planning, I talk about it in a way of really empowering you. I want you to feel as though every disaster is an opportunity to get empowered, to get better, to get stronger, and be mostly more resilient. Because that resiliency is what's going to ensure that your community theater is going to continue to operate well, even with the resources that you may have, whatever that happens to be. So first, before we really get into it, I'm going to start and I'm going to introduce a little bit of a concept that I introduce in every presentation that I engage with. When I talk to about 53 different industries. I work with hospitality, I work with restaurants, I work with nursing homes, I work with charter schools, I work with all kinds of folks. And the slide I'm going to show you after this one, I show to all of them, because this is the mindset I want you to get into before we get into the nuts and bolts of the challenges that you're going to face in this post-COVID world. Then the second thing we're going to go into is really the introducing the 5 major challenges that I think you're going to be facing during this time. So we're actually going to introduce what those 5 challenges are, and I'm going to discuss how to work strategies, how to focus yourself, how to focus your resources, and put yourself in a position to be successful. And then we're also going to talk about the timeline. And I'm going to talk to you about the timeline because one of the things that I think has a massive effect in the way people respond to these disasters is by not viewing this within a conceptual linear timeline. And by doing that, by actually seeing the way things are done and seeing that, no, you don't have to do everything right away. No, you don't have to do everything in 3 months. No, you don't have to do everything in 6 months. You can take these things in little bits. It makes it a lot easier for you as you approach these challenges one by one. So even though I'm placing the challenges to you sequentially, there's only a couple of it's only a couple of challenges that you need to do pretty quickly. The other 3 you can probably start doing over a period of time. And then lastly, we're going to take Q&A. But I will say this, I got some questions posed to me prior to the webinar and the broadcast. And so I will address those as we go along. So that Q&A will be important, and I'm happy to discuss any questions and answers throughout it. So let's begin first. This is the screen that I show every single person in every organization where I have worked with, where I have presented to, because I want you to remember something. COVID is like every other disaster, period. It's like every other disaster. COVID is exactly the same as a hurricane. It is exactly the same as an active shooter. It is exactly the same as a tornado. It is exactly the same as an earthquake or a volcanic eruption or a tsunami or a deployment of a weapon of mass destruction. They are all the same, and I want you to remember that. And you may think that seems a little silly for me to say, because you'd say, well, clearly hurricanes and COVID, I mean, those things couldn't be more different. A tsunami and COVID, that clearly couldn't be more different. And the answer I give to you is that's not. They're exactly the same, because you need to step back and look at it as any other disaster. So do you have to have plans for disasters? You do. The answer is an unequivocal yes. Do you have to go into a cycle where you are making sure that that plan is effective? And the answer is yes. So if you're looking at your screen, this is the chronology and the cycle I want your disaster program to follow, no matter what you are dealing with, COVID, terrorist attacks, whatever. They will all follow this exact same process. First, of course, is planning, and you have to have a disaster plan in place. I will just say this unequivocally. If you don't have a plan, you're not going to be successful. I've been doing this for 15 years. My father was a planner for 35 years. We worked for some of the biggest companies in the world. I worked with Fortune 100 businesses, and I sat with management of like big companies, and I would turn to them and say, guys, listen, you can't go without a plan. I actually had this conversation with a few Silicon Valley startups where I was working with them early in my career. And they would say, well, we're fine. We're a bunch of 24-year-olds and we got, $500 million. I'd say, listen, you're going to lose that if you don't have a disaster plan in place. You've got to have a plan. So these are things that become really, really important. Do you have to train people in your plan? Yeah, you got to train people. One of the things I tell people all the time is if you don't train anyone on your plan, you might as well have not written it at all, because it's a waste of your time. It was a waste of your time. It was a waste of management's time. It's a waste of your staff's time. It's a waste of everybody's time. Testing, I'm not talking about the SATs. I'm not talking about a quiz. I'm not talking about any of that. What I mean is viewing your plan through the prism of a particular disaster. So actually putting it to the test. Do you need to put your disaster program to the test? Yeah, because if you don't, the plan's never going to work, because you have to actually know that it's going to work. If you don't have a test, then maybe you have a disaster. So you can skip test if you actually happen to have a disaster before you're able to hold one. I want you to think of COVID as like another test in a sense. It's an opportunity for you to put your plans to the test. If you don't have them, now's your wake-up call to get one. Then you need to respond to any disaster. And then lastly, you need to improve your plan. And in fact, that's really where we're going to begin. This is really the improve arrow, that purple arrow that you see there is the genesis of where I want to start with you today. Because I tell people, if you don't have a plan, I actually will let you start at the improvement, but it has to lead into a plan. And I'll explain what I mean by that in just a moment. But the analog I give to you is that you need to think of COVID, hurricanes, terrorist attacks, whatever, within this context. You plan for it, you train for it, you test for it, you respond to it, you improve, you get better, and so on and so on and so on and so on. Just a few weeks ago, I was reading about the fact that there's an organization in the Middle East that actually came out with specific guidelines of how they wanted their personnel to respond to COVID. They said, if you're working together, I want you to, keep social distancing, where you need to wear masks. This organization mandated masks. This organization required people to wash their hands. This organization required people to not get in groups bigger than 3. And you know what organization I'm talking about? I'm talking about ISIS. FBI agents and others that were working overseas that actually got their COVID handbook, weirdly enough. And then ISIS, after they discovered that it had been compromised, they actually published it online. So if ISIS can have a COVID disaster plan, you can as well. So let's start with first challenge number 1. And this is really the first challenge. This is the big one. This is the one most people don't do. And I harp on this whenever I deliver presentations on COVID, because this is something that I want you to be considering as time goes along. You need to figure out what you learned. Everyone who is listening to this presentation, your theater was somehow impacted by COVID. Obviously in Michigan, you guys had some of the strictest, in fact, in some industries, it actually was the strictest lockdown procedures and measures anywhere in the country. And that's one of the things that becomes important, because when we think about the things that how we were required to adapt, it's things I want you to think about. Those are lessons that you can now learn. Those things are incredibly valuable. So one of the things, if you have not done it, you need to do this now. The first thing you need to do is you need to debrief with everybody. And what do I mean by debrief? I mean that you need to be interviewing all your staff. You need to interview all of management. You need to interview everyone who was involved in the first and second waves of COVID. We are in the second wave. It did, for those of you who know, it did start in early October. So we technically are in a second wave. And those are lessons, things that we learned. Well, what kind of lessons are we talking about? Well, here's a few things. What equipment did you have? Did you have the equipment that you needed? Did you have the personnel that you needed? Did you have the policies in place that you needed? Did you have the strategies for closing and reopening? Did you have the communication available? If there was certain communication you put on your website, don't let that just vanish into the ether someday. Make sure that you capture that information. If you didn't have a crisis plan in place, if you didn't know how to communicate with the media, if you didn't know how to communicate to your patrons, to your season ticket holders, to the people who donate to you, if you didn't have a unified strategy on ticketing, that became a huge issue in a couple of different states where people were literally saying, well, what do you want me to do with my season tickets? Do you want me to donate them? Can I just give them to somebody else? Are you going to refund me? These are policies and things that you worked on, you were strategizing on, and now that you've gone through the first and you're in the middle of the second wave, now's the chance for you to apply all those lessons and capture them. Capture them. Don't lose them because you spent so much time and effort capturing them. So make sure that you hang on to them and learn from it. So when should you do it? Do it before Thanksgiving. If you haven't done it already, do it by Thanksgiving, please. The second thing you need to do is, and I say 30 days, I know it's not 30 days until Thanksgiving, but I'm going to be a little flexible because I understand that for everybody, it's not as easy as saying, well, I can just do it in, 2-3 weeks. It takes a while. That's fine. That's fine. But do it before Thanksgiving. The reason is because if you do any longer than that, memories will be lost. People will forget. People will move on. People will quit, etc., etc. The debriefing, you need to get someone from outside your organization to do it. I can cite study after study after study after study that shows that employees, even in very loose, very trusting employment atmospheres, that they will not tell the truth to their supervisors when lessons are being learned because they don't want to be perceived as criticizing somebody. They don't think the stakes are high enough. Even during COVID, people don't think the stakes are high enough. They're not prepared to criticize anybody. So you need to get an unaffiliated person from outside the organization, not affiliated with the organization in any way. And no, don't get the best friend of the owner, please, because that doesn't help. I know that that's the way that it feels like. Sometimes the theater manager has that one friend that everybody likes. No. You need to get somebody unaffiliated. And what I tell this to big companies all the time. Get somebody who is a dispassionate, unaffiliated person, meaning they don't care. they don't care. They don't care who did what. They'll write things down. They're not going to say anything about, well, Joe Blow said this or that. Don't do anything along those lines. Make sure that you are debriefing with staff, with performers, with volunteers. Everyone needs to be involved. Doesn't have to be one big, large meeting, but have a couple of meetings, 20 to 30 minutes, and just ask 2 questions. That's all I'm telling you to do. 2 questions. What we do well, and what do we have to work on? That's it. That's it. Now, what goes under those questions is, what do we do well in terms of equipment? What we do well in charge of supply? What we do well in charge of communication? How we do with closing? How we do with reopening? How we do with the website? Go through every plank of how you operate your theater and think about that. Did you sanitize? Were the sanitizing procedures implemented properly? I know a couple theaters I was working with that I later questioned them and asked them about things. And one of the things they told me was that, yes, they had set up all these stations, but a lot of times people didn't want to keep washing their hands. They didn't want to do that. And so they had to start getting after people. So they had to start implementing more difficult procedures. I had one theater that said that a performer refused to leave after they were instructed to leave because they were coughing. And they said, you can't force me to leave. And unfortunately, their contract said that they were right. You cannot send them home for that. So I told them, okay, so what we learned from that means in the future, when you write these contracts, you have to make it clear that if you are ill, we have the right to send you home. We had theaters who didn't determine who was allowed to send people home, who was allowed to set policies, who was allowed to deal with stage managers, yada, yada, yada. So these are things you need to be thinking about. Don't worry about this big term after action report. Basically, think of it as this. Take a piece of paper right now or whenever you're going to do this, take a big piece of paper, take a pen, put a line down the middle. That's all you got to do, put a line down the middle. On the left, right, what did we do well? On the right-hand side, we do what can we work on? Not how did we fail, not who sucked, not who can we shame today, none of those things. We just say, what can we do better or how can we improve, whatever. Just make that very neutral language. And then start writing it out. Again, this doesn't have to be some huge technical document, folks, but I want you to capture it down. That information is really, really important. I tell people, you spent so much time dealing with COVID and dealing with everything. Why not write it down? It's really, really valuable. Spend a little bit of time and do that. Then you can start implementing it back into your disaster plan. You can take what the lessons learned. You can say, what do we need to work on? Look at your disaster plan and figure out how to fix it. Simple as that. If you don't have one, figure out what your plan needs to include. That's a great lesson right there. So those are the kinds of things that become really important. And trust me, if you get the right person to do those interviews, you will learn a lot. I can't tell you the number of times when, because I was an unaffiliated person, I had companies who hired me out, that's all I did. And they used to hire me, and I used to go to the company, and I used to talk to management. I used to talk to employees, and I'd say, what was up? And they're like, are you going to tell management? No, I'm not going to tell anybody anything. I don't know any of you people. I don't know anybody. I'm just here to write down what's going on. We're not here to shame anybody. Let's just figure out how to improve it, which leads me to the final plank, which is the improvement plan, which is you need to write down things. What are we going to do to improve? How are we going to make this better? Don't just write it down and forget about it and stick it in a drawer and say, well, I did it. I'm done. Good. No, you have to actually implement the project plan. You have to say, here's what we're going to do in regards to staff. Here are the changes we need to make staff-wise, not firing people or anything or terminations. It means that you need to say, what policies and procedures do we need to improve in regards to staff? What policies and procedures do we need to implement in regards to volunteers? What policies and procedures do we need to implement in regards to management? These are things that all become important as we deal with COVID and as we move forward with them. Okay, so here's the basic chronology of what you should be doing in a lessons learned scenario. First, you do the debriefing, right? So you're conducting that 20 to 30-minute interview with everybody. Again, the performers, and trust me, I was a performer myself. I get it. Sometimes they just want to be interviewed with other performers. They don't want to do it at the same time as volunteers or staff. Even when I was doing this at college, there were times where we had to do a debriefing because one time we were on stage and the set piece actually broke and 3 people were injured. And OSHA, I know it's going to sound weird, it's true. OSHA actually came to the university and demanded to speak to everybody because somebody was seriously injured, which did require an OSHA notification. So literally, there were performers. These are collegiate performers who said, I don't want to be interviewed at the same time as the stage managers. I don't want to be interviewed at the same time as staff because I don't want to say anything that could later on be, impact my ability to get cast in a future production. And at college, there's a lot on the stake. You can lose scholarships. You can lose opportunities for different things. I mean, there's a lot of things on the line. So one of the things that we did was we said, we're always going to have an outside person who's going to conduct these kinds of interviews. Then you're going to conduct, just as I said, just that 1 to 2 page after action report. Then you're going to say, here's some things we're going to improve. Then guess what? Do it. Actually implement the changes. Actually implement these things. Think through what you would have needed to have to be more successful next time. If you said, I didn't have a disaster plan before and now I need one, there you go. That's one of the things you need to do. That's your highest A priority thing you need to be conducting. So you need to conduct a full disaster plan assessment and have one created. It's not, again, I'm throwing a lot of big terms around, but again, these don't have to be complex documents. I've written literally hundreds of community theater plans. These plans are not real long. Mostly the plans I write range between, sometimes they're as short as like 5 pages. Sometimes they're as long as maybe 20 pages. So, I mean, we're talking about not huge documents, but they cover the things that need to be covered. Because if you don't do that stuff, then you're in a position where you're going to be caught flat-footed again. And was like, well, we had an opportunity last time to learn a lot, but now we don't have a whole lot of things that we can do this time. Second challenge for you guys is going to be personnel. Personnel is going to be something, as I was mentioning with challenge number 1, that needs to be implemented immediately. So there is certain equipment that you're going to need to start implementing in the post-COVID world. First, you're going to have temperature, ways to check people's temperature. I know a lot of you are already way ahead of me on this. I think that's wonderful. I just want to make sure I'm being completely comprehensive. You need to have some method. It needs to be touchless. That's required. It needs to be touchless. And it needs to be something that is, well, what we call rapid deployment, meaning you can do one person after the next, after the next, after the next, after the next. I know that there's going to be a question on this. I know somebody will ask me. They always do when I deliver these. Should we do this with patrons entering the theater? The answer is yes, because you are in a situation where people are literally being crammed into a little room. I know I'm oversimplifying it. I don't want to totally take away the magic of the theater, but you're literally sticking people in a little room, especially if you're like a black box theater, where you have like people, centered together. They're only a few chairs away from each other. These are places, and we're talking about an airborne illness here. So you want to make sure you're taking people's temperature. You have a way of doing that. Second thing, you need to be making sure you're sanitizing things, that there is a way for you to sanitize. And when I was first delivering a presentation like this one to ACT, this was in April. So we were in the very early stages of COVID. This was back when it was like, you have to sanitize everything that comes in your house. And if you actually hear that we're recording, you'll hear me say things like, don't let anything get in your house you haven't sanitized. Okay, today it's a little different because now we understand a little bit better what COVID does. However, it does need to be mentioned that we do not know, with 2 slashes below it, do not know how well COVID is passed from one person to the next on surfaces. We do not know. CDC is very clear on that. There is no known politician that I've ever heard of or any doctor that I've ever heard of who said, we have the absolute answer. We know how surfaces and COVID work together. We do not know that. Those studies will likely come out. We're looking at probably 8 months to a year. Hopefully we have a vaccine by then, and I'll talk about a vaccine in a little while. So you do need to have sanitation equipment. You do have to make sure you have soap. You have to make sure you have hand wipes. You have to do all these things, especially surfaces that are touched very frequently. I got a question about props. The answer is yeah, you have to wipe down props. Yes, every night. You have to make sure that you're doing it systematically. You don't just have somebody walking around just kind of wiping each one of them over. No, considering the amount of manipulation that goes on of the object, that you actually have to wipe it down, especially things that are touched frequently, things like fake weapons, things like lamps that get turned on off, stuff like that. These are the things you have to make sure you are constantly sanitizing. You have to have policies, new policies dealing with personnel. You need to have things dealing with rotating shifts. I've had this question come up a few times asking me about volunteers who are maybe septuagenarians or octogenarians. When that is the case, and when you have those folks who are in your theater, you need to be aware of the fact that if they are interacting with people who are also in the same high-risk group that they are, that can be very problematic. And that's something you're going to need to think about. That's not automatic. It's not, you can't just be a free-for-all on, well, just whoever's going to do the shift is whoever's going to do it. You're not going to be able to, it's not going to be like that again. That will never be the same. I was dealing with this also in healthcare facilities where I was talking to people saying, there are times of the day, whether we like it or not, that people are more virulent. That's the way it goes. So there are things that we have to do. Your immune system throughout the day changes, the time of year, depending on people's hydration levels. All kinds of things can impact how well people can get sick or not. You have to have clear policies on sending people home. I've already talked about a couple of these policies before, but I will say this to you right now. If you are going to reopen from this day forward, if you say we are going to reopen, before you open those doors, you need to have an absolute policy on sending people home. And here's what it's got to have. Number one, it has to say exactly what criterion calculus has to be met in order to send somebody home. If you follow the CDC guidelines, via con Dios. If you have your own guidelines, great. Whatever it is, you've got to lay that out. Number two, you have to have what we call an agent of action, which means you have to have individuals who are empowered to send people home. This needs to include the following: management, line staff, volunteers, and performers. So there needs to be a policy for every one of them. Don't say don't write a policy that says, well, for everybody, if you have 100.3 or higher, and you've been sick for a couple of days, you have to go home. No, you need to say for performers, ... for management, ... for staff, ... because if it's too broad and generalized, people will try to go around the policies or they won't see it as anything of value. So you need to lay that out, and that's needs to be really clear. And the third thing the policy has to say is when you will allow them to return back. Again, that's not an obvious answer. You need to think it through based on what is going on with your particular theater. The state will dictate some of this. Michigan has been pretty assiduous about putting together these policies. However, I will warn you, I'm out in California where they have also been very strict and they are very clear on sending people home. There are still gray areas, and you don't want management to rely on that because guidelines do change. I will tell you the guidelines in the last 3 months have changed more in this one instance than I think in almost anything I've ever seen in my entire career. And I've seen a lot of stuff. I was there during H1N1. I was there during SARS. I actually lived in China for a time. So I know what these kind of things are like. So you need to be aware of that stuff. You got to train everybody, which means you have to have eyeball to eyeballs, meaning you need to make sure that everyone knows exactly what your expectations are, what you want them to be doing. That becomes really, really important, that you train people on it and you make it clear that management's not fooling around, that if people are sick, you are going home, period. That's just the way it goes. You need to also be clear on policies regarding COVID positive diagnoses. I do have a theater that I work with who has decided that people who are showing up for certain kinds of events at the theater, people who are personnel at the theater, they actually will have to get a COVID negative test before they are permitted in the theater. That is their policy. And I understand that for them. They have a lot of professional performers who do work there, and they do have demands that they do have to meet, and there are certain expectations that are maybe a little different than other community groups. It's up to you, but you do need to develop policy. You got to train people on it. You do have to have absolute policies on rehearsals and on productions. Obviously, in your theater, it may be that the stage manager has ultimate authority. That's fine. Sometimes it's the director. That's fine. Sometimes it's a staff member. All fine. Either way, someone has to ultimately say, this is how we dictate things during rehearsals. There needs to be clear policies on dealing with choreography, dealing with actors who have to do an intimate embrace of some kind. This becomes true also in musicals where there happens to be a lot of touching and physical interaction. There needs to be very clear lines delineated. And you know, what's the thing? I actually have a couple theaters that actually had elected not to perform certain kinds of performances because they realized that there was just too much intimate contact and they wanted to keep people a little more distant for now. And that's the way they decide to handle it. So, okay, so let's go ahead and talk about reopening now. Because now we've sort of talked about capturing some lessons learned. That's great. We've talked about personnel. That's awesome. We need to implement those two things immediately. Now, reopening is a little different. So we don't know when we're going to reopen, or maybe you've reopened, or maybe you're in stages of thinking about reopening. Wherever you're at, I'm not making any generalizations at all. But I want to say that these are some of the things you need to be thinking about. Staffing, we've already talked about. Scheduling, we've really talked about mostly. Here's the thing we need to start talking about: ticketing. Okay, a couple things to be aware of in regards to ticketing. There are going to be situations where you are going to, and matter of fact, I have a lot of theaters where this is really true, where they say the vast majority of my season ticket holders are people in the vulnerable category. That is either because of age or because of disability. Either way, they don't feel comfortable with having someone who is not in the vulnerable category in the room. I've had some theaters who have done the opposite, who they've said they don't want too many vulnerable people in the same room at the same time. Again, the medical science on this is changing very rapidly. So what I would say is I don't know the answer. I'm not a medical doctor. I don't know. But do you have to be thinking about that? Yes. Do you have to think about what is going to make people feel comfortable? Yes. That is what I really try to emphasize to theaters I work with. Make sure that people feel comfortable about what they're doing so that they feel like when they come to the theater, you are doing and following the expectation and guidelines. Will call issues before we talk about seating itself. You see there I have a little thing, please keep a safe distance of 6 feet. That's obviously the social distance. You can buy those things online. I find those to be really good to actually have those outside of ticketing areas where you actually have the actual place where you want people to be standing. You would be amazed at how well people will follow that if you actually put it out. Don't let people guess. If you expect people to stay 6 feet apart during bathrooming, that's fine. But then you need to lay those out so people understand that. In dealing with seating, are you going to have to do a phased approach? Probably. In fact, I can't think of a single theater. Matter of fact, now I'm thinking about this. Let me think about this. I can't think of a single theater. And right now I'm working with over 300 of them just on COVID alone. I can't think of a single one of them who said, you know what we're going to do? Everyone can just go in whenever they want to. They can just go in. We're not going to modify our seating procedures at all. Every one of them is changing the way that they are seating people. So they're doing them in phases. So for example, you might have the front seats, and then you might have the back seats, or you have the balconies, in certain rows, or odds and evens, or whatever it happens to be, and you know you can't see people next to each other, so you have to make sure there is limited interaction. Is it going to be simple to do? No. Is it going to require practice? Yes, you will have to practice, because seating people is a science. And I know this from experience, that this is not as easy as it seems. So make sure that when you are seating people, you have the policies in place. Can I talk about every single type of theater? No. Every theater is different. I've been to a number of community theaters. Each one of them is so dramatically different from the other ones. And that's what really makes this industry so wonderful, and why I enjoy giving back so much to it, because you guys are terrific. You do a wonderful job. But the seating is going to require some thought, and there is no universal answer. So you do have to lay that out in regards to seating. Ingress and egress, which I've just discussed, which is getting people in and out. One of the big questions is going to be, well, what do we do during intermission? I have a 15-minute intermission, or I have a 20-minute intermission, and I've got people standing in the bathroom lines, and it's 6 feet apart. They're going to be like down the block. Okay, so it may be that you're going to have to either elongate intermission, you're going to have to offer something else, you're going to have to do it in phases, whatever. But almost like on an airplane. I was actually on a plane once overseas, and they actually had to do them in blocks because there were so many children in the plane. I was flying over to Asia, and there was some reason there's happening to be a lot of kids, and they actually said, they'll block it out so that people can use the restroom. So there weren't too many people standing in line, because when for those of you who've flown internationally, you know that they don't allow people to be standing up in the galleyways at all. So that's one of the things that really becomes important. You need to lay all that stuff out. You may need a fair number of those little 2 feet. Ingress and egress, will you have to take temperatures of people coming in? I would say yes. I wouldn't fool around if I were you. However, if you decide to do that, that's fine. But one of the things you have to do is that you need to have policies, and you need to train people on customer service, so that people are not saying, oh my gosh, you're sick, you got to leave. Because if you say that, if somebody says that, that's going to freak everyone out, number one. Number two, they're going to instantly feel like a typhoid Mary, almost literally. And then number three, it is going to ostracize not only that person, but the people around them. So make sure that you are training people and you have a script. I know it sounds a little random, but in customer service, that's what I train people to do when we do disaster preparedness in big companies, where there has to be a standardization of procedures. I tell people, if you're going to do temperatures and stuff, you need to literally have a script that people read. Or it doesn't have to be that they read it, like on a sheet of paper, but they need to have it in their head so that they know within a small deviation. It doesn't have to be word for word, but it's got to be within a small standard deviation. Basically, it's what is written there, so that no one feels ostracized, no one feels that way. Maybe you do it in private, whatever. That becomes really, really important. Bathrooms, we've obviously talked about. And then intermissions, we've discussed to some extent. Intermissions are going to be difficult. Intermissions, no matter what, I don't care how big or small you are going to have a policy on intermissions. There is no ifs, ands, or buts about that. You will have to have that, because if you have people who are seated at the edge of a row, other people can't be passing them. They cannot be doing that, because they're literally, not only are they within 6 feet, they are probably touching each other, and that is not acceptable, period. So there may be policies. I actually have a theater I'm working with out in Kentucky. They actually have a intermission policy where literally you are required to get out of your seat. That means they egress exactly the way they ingressed, and that at intermission, there literally is somebody walking around that actually, and since the intermission area, since the seating areas are actually empty, sometimes they have people who will actually sanitize the seats and the armrests in between. You don't have to do that, but they certainly have to think about that in the long run. So you have to think about parties as well. Obviously, cast parties are huge. That was one of the keynote experiences when I was in a play, especially a musical, having parties, having things like that. Having even this even comes up where you have a group of people who are holding someone's birthday party, and they decide that they're going to go to the theater and they're actually going to see a show together. and then they're going to go out to a restaurant or whatever. Okay. Even in those situations, parties have to be handled in a certain way. You have to watch alcohol consumption. If you allow alcohol, these are things that have to be considered in the long run, because you're going to have to monitor people a lot more. And I know you don't want to turn your theaters into a police state, and I'm not asking you to, but you do have to put yourself in a position where you are reopening the theater in a way that people feel comfortable. Not only the people who are attending, but volunteers too. Do volunteers need to be masked? Of course. Are they going to have to wear gloves? Probably. In fact, I would actually say that if it were my theater, I would tell everyone you must wear gloves every single time. No question about it. And that means you're going to have to buy disposable gloves. I don't want people touching anything. Obviously, performers on stage can't use gloves for the most part. I know a couple of theaters that have tried some sort of creative ways of getting around that. I don't have time to discuss them today, but there's some really creative things that you can actually do. But the reopening element of it, the point I'm trying to make with you on this slide is you've got to create these policies beforehand. Don't make them up during your reopening or during the first show, or say, you know what, I'm going to run the first show. I'm just going to see what happens, and then I'm going to play it out. I can't tell you the number of theater directors who are really good, really know what they're doing, that do that stuff. And I've turned to them and say, that is just the height of insanity. You can't do that, because I will tell you this. If there is a COVID outbreak at your theater, you are closed and you are not reopening. I'm just telling you that right now. It doesn't matter what state you're in, because if you have a massive outbreak, either the government will close you, which will be the case in most instances, especially with this political atmosphere, or the press will. The press will close you, because they will put out a number of things saying these people didn't think this through, they didn't do this, they didn't do that, and that will ultimately doom you, especially since a lot of you folks have season ticket holders, you have performers who are coming in from, they'll have different sort of acting troupes who will come in and just do, they'll just they rotate between theaters. They're not going to use your theater anymore, because there is no way they're going to want to perform in a theater that was responsible for an outbreak. There's just no chance, not going to happen. So how are you going to handle this stuff? So how do you handle it? Every morning, you need to review guidance from the CDC, from state public health, as well as from the county, or if you're in the state of Louisiana, the parish. So you need to look through the guidance and reopening every day. I know it's going to be boring. I got it. Trust me. I feel you. I get it. But you got to do it, because things change weekly, daily. In California, I actually had one where they actually changed the guidance overnight, where I went to bed and I gave people certain guidance. I woke up the next morning at 8 o'clock in the morning, and the county had given completely different guidance and said, no, never mind, we're going to go back to this other thing. So we had to go back on the phones, and I had to have my customer people calling people saying, okay, we have to change this now, and that's the way it goes. That's our job. That's part of the responsibility. But you folks need to every morning pull it up on your phone, tablet, computer, laptop, carrier pigeon, I don't care, whatever. Just get the guidance for that day. There is a place that you can find them. CDC has a site where it's updated every day that there is a change, period. Your state public health, every state in the country, including Michigan, will have this. In your county, in Michigan, they will have guidance. You know this. You guys are in Michigan, you get it. So please do that every single day. Please do not fool around. Here's going to be your fourth challenge. Once you talk about reopening, and these are some other things. Obviously, I couldn't cover every single element of everything you need to consider in a reopening. Clearly, you have to think about food delivery. You have to think about drinks. Yes, you got to think about that. You have to think about or if you're going to have people eat, do they have to wear their masks all the time? If you're in the state of California, the answer is an unequivocal yes. If you serve food in any way, there's no more buffets in California. For those of you who ever come out here again, there's not going to be any more buffets anywhere. They're gone. They're done. So those are in Vegas too. And actually, I do a fair number of plans out in Vegas, and those are all done too. So those are the kinds of things. Does that change the way you do things? Absolutely. No question about it. So, fourth challenge is dealing with what we call secondary disasters, things like Hurricane Delta in Louisiana, thinking about massive storms. For those of you who get, massive blizzards and things, you're going to have to rethink about your assembly areas. Where do you assemble people? Where do you ingress? Where do you egress? The days of where you can shelter in place or lock people down in a single room where you have a large crowded area, those days are gone. You can no longer shelter in place with everyone in one area anymore. That is not permitted, period. You cannot do that because you will get people sick. There's no question about that. And before I go on to the next element of this, there's one other thing I want to discuss with you, which is the issue of vaccines. Okay, the vaccine has been promised and promised and promised, and now the latest word is that we're going to get one by March. Okay, I don't want you to base your disaster plans, to base your policies, base your procedures on that date. Do not do it. You do that at your peril, because even if a vaccine is passed, it doesn't mean that the rest of this stuff just automatically stops. That is not what's going to happen. So I know a couple of theaters who called me and said, well, as soon as they have a vaccine, all this stuff just disappears. Nope, it does not. Some people are not going to get the vaccine. There will still be political pressure. If we have a bad cold and flu season, you can't imagine what's going to happen. So you have to make sure you're being careful. Can you crowd people in place? No. Do you have to socially distance people? Yes. So if you're in an area that gets, say, tornado warnings, you can't have a single shelter-in-place location where you jam 100 people in there. You simply can't do that. You have to find areas where you can distance people appropriately. So if we get a tornado warning, or even if we get a watch, I mean, I know a couple of theaters, not a lot, I know a couple of theaters who say, well, if we get a watch, like we start putting people and start crowding people together a little bit just in case it turns into a warning. I go, well, okay, that's fine. There's a lot of watches. That seems like a hard thing to implement, but if that's the way you're going to do it, that's the way you're going to have it. But you still have to socially distance people no matter what. Do you have to have policies on PPE? Yes, you do. You need to be prepared to enforce that stuff. If performers are instructed to wear certain PPE, they need to wear it. During rehearsals, during whatever, if you do Zoom rehearsals, great. If you don't, great, whatever. But you have to have a PPE policy in place. You have to implement that, particularly with dealing with secondary disasters, because you'll have a lot of people who may have to evacuate or may have to go somewhere, and those are things that can change you. Last is what we call threat plans. Threat plans are things like blizzard plans or earthquake plans or active shooter plans or whatever. Those are plans you still have to think about in the meantime. Those of you who know, of course, the FBI thwarted what actually would have been considered a terrorist attack, which was there was a group of men who decided they were going to kidnap the governor of Michigan, right? And so that is actually considered a terrorist attack, an attempted terrorist attack. And those are threat plans that you have to, they had to consider in place. Now, does that mean that they can jam security people together in one place? They cannot do that. Now, of course, if a life is in jeopardy, of course they're going to do that. But even in those instances, if there's things that are anticipated, there are procedures and activities that you can do in advance, which can protect people while maintaining some amount of social distancing with masks and everything else. It's not perfect, but you still have to consider it no matter what. You can't simply ignore that stuff. Regardless of whether it's a natural disaster, a technological disaster, and technological disasters are things like transportation accidents, power outages, hazmat spills, meaning like chemical spills and all that stuff. And then security emergencies, things like terror, acts of terror, active shooter events, belligerencies, criminal events. We actually had an incident at a theater down in Florida where they were actually, the theater was packed full of people, and there was actually an armed robbery going on in the lobby at that time. So those are the kinds of things, they do happen from time to time. So those are the things you definitely have to prepare for. And the last challenge, which is only going to be a couple of minutes, that's pretty much it, because you guys pretty much get where I'm going here. You have to prepare for secondary quarantines. You need to prepare your operations for that. You need to prepare for a massive flu and cold season, which means you need to be communicating with people very clearly. You need to communicate social distancing. You have to maintain a cleaning schedule. These are not things that you can skip. We are anticipating a moderate to bad flu season this year. Now, is that crystal ball work? I don't know. Is that based on real epidemiological research? I'm sure it's based on something. Even when we predict hurricane seasons, we base that mostly on science as best we can. But again, the crystal ball is going to be in the shop, so it's not exactly working exactly. I can't predict. Well, you're going to get 2 in September, 3 in October, 2 in November. You just don't know. So even if we get a flu and cold season that is really bad, you have to understand that that's almost as bad as getting a COVID outbreak, because you're going to get a lot of people sick, and you know what's going to happen? A lot of people are going to think they have COVID. That will create a panic. If one employee says, well, I think I got COVID, everyone else in your theater is going to panic, everybody. So you need to anticipate that. You need to anticipate communications. You need to anticipate how your operations are going to respond to that. Your cleaning schedules need to be rigorously followed every single time. No skipping. Every single time. Between performances, yes, you have to clean. And I'll talk about cleaning supplies during the Q&A in just a minute. The last thing that I want to talk to you guys about, we don't have a lot of time to discuss this, is dealing with financial stresses. I've seen now a couple of theaters who said, well, I'm just going to rely on another PPP or EIDL loan. Okay, those may not be available again. I'm just telling you that right now. Donations, great. There's a lot of policies to implement in regards to donations. I had a couple theaters that actually have some great stories about how they had set a financial goal for themselves and they actually beat the goal. And that's terrific news to hear, because that's one of the things that I think is really important, is getting an organized donation campaign together and having it in place. Please don't do it on a reactive level. Please have a meeting with management now and say, if we run into financial stresses, what can we do? Don't do it when you're under the gun. Don't do it. Do it now, when you have a chance and when you're actually able to focus, because that is going to put you in a position to be successful. Excuse me. And okay, last thing is the timeline of implementation. When you're implementing a disaster program and you're thinking of things, you need to do it on a consecutive level. The next 12 to 18 months are going to be critical. You need to have a disaster plan in place. I'm going to visit every one of your theaters at some point. So don't anyone say I'm never going to visit your theater, because I love Michigan. I go there every year. I love it up there. And I'm going to go to your theater and I'm going to go and visit it. And I can't wait to meet all of you. Of course, some of you guys have some terrific theaters, some great productions, and I want to see every one of them. And I want to see your disaster plans. I want to see you guys have a plan in place. I want to see that these things are organized. And that's really important, because that really helps you. Within 12 to 18 months, if it's not done, you have lost a window. You have lost a critical window to be successful. So I want you to think that through over the next couple years, but begin now. Over the next 0 to 6 months, put together the lessons learned, start implementing the personnel policies. Then over the next year, start when you're going to reopen. Get the policies and procedures together, implement them, think about them in terms of other disasters, and then begin working it through every single other point of the disaster response. So if you're able to do that and implement those things successfully, then I think you're going to be in a wonderful position, because this is not going to last forever. COVID is another disaster, just like anything else. But if you put together the right policies and procedures, you're going to be in a place not only to be able to react well to it, but you're going to be resilient, not only for this disaster, but for the next ones right around the corner. So thank you all very much for having me. So I'm going to go ahead and take, there were a couple questions that I was emailed beforehand, and I want to discuss them a little bit for you. And then I will take some other questions as well, and I'm going to surrender the floor to Jamie in a couple minutes here, and then he'll take it from there, and I'll answer any questions that you may have. One person asked about an air exchange system, especially for smaller theaters. There are air exchange systems in place. I can't specifically endorse any particular air exchange systems, because there are legal issues around that, but I can say that they do exist. They are out there. However, what I would ask is that here's a couple things when you are evaluating them. This is what you need to be looking for. 2 things. Number 1, EPA. You need to determine if the EPA has evaluated the filter. So look at the filter or whatever the air exchange system is that you are using. Make sure that that has been evaluated by EPA, and the other is OSHA. So make sure that those have gone through those 2 organizations in some way. See, in California, California has its own OSHA, we call it Cal OSHA, and they actually set their own standards on these things, and they are catching up and discussing COVID. I don't know every one off the top of my head, but I will tell you that they do exist. The second question someone asked was about UV lighting. The answer is an unequivocal no. UV lighting has no effect that we know of on COVID. That's one of the things CDC is very clear about on their website. And they mentioned it during a couple of different press conferences as well. I know it does come up because people do ask, well, I thought the UV light would work on this. And the answer is it might. It might. But given the evidence we have right now, the answer is no. So that's one of the things you cannot rely on. Someone asked me about disinfecting wood surfaces, fabrics, and things. I can't give you, although I actually do have a brand that I really like and I've seen implemented at a number of theaters. In this particular instance, I can't mention it to you, but I can say this. If you go on the CDC's website, they have a list called List N. N is in Nancy. List N. List N has all of the different products that you can use that are COVID approved. So don't just Google COVID approved. Okay, I'm sorry, EPA approved COVID, COVID chemicals, okay? Because anyone could write that on Google. Anybody could do that. Anybody could put that on the internet, So what you need to do is go through that list. It has exact brand names and it has exact product names. And I think it has the product numbers. It didn't before. I think it does now. So they're really good about updating that list. That list has gone through a number of iterations. When I spoke to ACT about 4 months ago, we were actually on list, I think we were on list on list J or so. So it goes through a lot of iterations. They add a lot in there and it will continue to grow only as time goes along. But there are disinfectants you can use. I will say that the airlines, again, because this is not a product you realistically will be able to use, the airlines use a particular product, and there's one called Virox that's used in healthcare facilities. Again, you're not going to use Virox, probably. It's very expensive. There's one called, I think it's called 1820. Again, that's something the airlines use. You're not going to use that stuff, so you don't have to worry about it. You don't have to worry about trying to aerosol it either. Just use it directly out of the bottles itself. Those are the ones that you should use. But if you were to ask me and say, where would I find and where would I figure out what would be the best ones for my theater? If you want to Google them, totally good. But keep that PDF from the EPA on that's List N, keep that on your desktop so that you can use it as a reference point. And if you're reviewing the website on a daily basis, again, we're not talking about novel stuff. We're just talking 2-3 lines a day CDC ads on its site. Sometimes nothing at all. But if they create a new list, delete the old one and add the new one, because the new one's going to be called List O because it goes in alphabetical order. So they'll keep going all the way through those lists. So you want to make sure you're finding a disinfectant that fits best for you. For those of you, I know there's a few of you who are clients of mine. If you're a client, then we can give you exact ones because we're obviously under contract. But otherwise, I have to be really careful about that. Some people were asking me about people who want to actually be in the live, who want to actually see and be in a live theater. I think it's perfectly great to want to have people in the live theater. Again, you just have to take precautions about who comes in. One of the things I emphasized in this presentation, and I re-emphasized it because of some of these questions that I've gotten. I just wanted to make sure that it was really clear that that whenever you're having patrons enter your facility, you need to make sure you are checking them. And now that there are technologies, there is touchless sensors. We have, really easy, inexpensive ways of handling it. If you guys want to get a donation, that's a great way of doing it. Saying, listen, I really want an industrial one. I want an industrial touchless thermometer. Just go to a donor and say, hey, would you be willing to buy one off Amazon or something and then donate it to us? Because some of the really good ones, like $300, $400, but they are great and they'll never make a mistake. And so you'll be it'll put you in a position to be as successful as possible. So remember, these are your facilities. They're in your place. And I'm sure that there are some other questions here. But what I'm going to do is I'm going to go ahead and stop the share, and I'm going to hand it back off here. And then as other questions are up, I'd be more than happy to answer those. So back to you, sir.
Patrick, thank you so much. That is simply an incredible amount of information. And what a great path and really a way to start the plan. I have to be honest with you. I haven't had a chance to sit in on any of your previous webinars with AACT. But I can tell you that it was, at times, sitting here, listening and watching your presentation, it was almost a little bit overwhelming to think about how we need to change and step up to all of these new challenges, where we may be smaller groups or mid-size theaters who, you know, really might depend on all of our revenue from ticket sales, you know, operate on an entirely volunteer basis. It is incredibly challenging to think of all of these new roles that we will need to fill and change to. So I did want to remind all of our attendees that we will have this, this video available on the ctam.online website. Hopefully that'll be up within the next couple of days. And Patrick, I do believe that you offered to share your PowerPoint presentation, that we'll hopefully have an opportunity to email that out so that you guys can start putting your plans together. And in the immortal words of Johnny Cash, it's going to be one piece at a time. You're going to be putting these plans together one piece at a time. And I think the wonderful thing to take away from this is we have some time. You know, we do have some time before we look at being back in the theater, you know, in a meaningful way. So it's definitely something that we should all start to get working on as soon as possible, but definitely an attainable task, especially with the framework that you gave us tonight.
I think there's a question actually. Is it okay if I answer any questions, Jamie? Is that okay? Or do we have time or no?
Absolutely. I saw one or two up on the chat.
Sure. And I will mention a couple things. One of the questions that I see here is someone was asking me about ULV fogger systems. And the answer is you need to be very careful because simply fogging a room could be a violation of federal laws. You have to be very careful about that. There are laws about air quality and things. So you just have to be careful. I will say good fogger systems are worth it in some ways, assuming you are not breaking any laws and that you are going to list N. Again, that's list N as in Nancy. So that list will have approved fogger systems specific for COVID. So if you can get them and you can afford them, they can be worth it. I've never used one myself, but I will tell you this, airlines use them. Some restaurants are going to be using them. In fact, I know I work with a restaurant system where they actually are required under their management corporate contract that before they actually reopen, they have to have a fogger system in place for certain areas of the restaurant where there are performers. So like, for example, they'll have an open stage. Okay, you can have an open stage theoretically, but again, you have to, because the amount of singing that's going on, because of the amount of activity and things with people that are not wearing masks, you have to implement a mental system. So that also could be part of the issue in regards to fabrics, because fabrics are really hard to disinfect as well. So I hope that that's helpful as well. So.
We've got a couple of comments here, some appreciation. Mary Lou Britton looking to see what you might look like, Patrick.
I'm not a very attractive guy. That's why I have my video off. No, I'm just somebody asked a question here. If you need to send a patron home, should you be prepared for immediately their ticket? I assume you mean refund, and my answer is it would, and I think what you wrote, Jamie, is absolutely right, which is you base it on your refund policies. The one thing that I tell people to do is to be very clear. Please communicate your policies early and often to everyone, so that is clear. So for example, if someone is making a purchase, when they purchase the ticket, you need to have some kind of addendum or something on the thank you screen or on the closeout screen of the sale where you say, just be aware that these are our policies, A, B, C, D, E, F, G. Because you guys know how this works, and we all run companies here basically. It's, you don't want to be seen as being arbitrary with anyone, obviously. So you want to make sure that's consistently applied across the board. So I hope that's helpful.
I think very much so. And definitely something that like just putting these little pieces together, you know, each of these pieces that you spoke about tonight, you know, they're not an insurmountable task to put together. And it's
Right.
Definitely something that we have to do as a responsible entity in our communities. Nobody wants to be what they say a super spreader. They don't want to be anyone that, like you said, running the risk of being shut down by local or state government. We certainly don't want anything like that to mar the great reputation of all of these theaters throughout Michigan and beyond. So
Right.
I don't see any more questions coming in. We've got some great positive feedback. I want to say a big thank you to Patrick. We really appreciate you sharing all of your knowledge, your information. Just a fantastic program to start the whole week off here at CTAM's Fall Conference. I want to remind everyone that's still viewing that we do have plenty of more workshops throughout the week and some wonderful roundtable discussions coming up as well. If you haven't signed up, you can absolutely do that at ctam.online, just the same way you signed up for tonight's session.